All right, everybody, welcome back to another episode of The Founders Cut. Today, I'm super excited to have Stephanie Greer, co-founder and CEO of Akin Mental Health. We got the chance to connect a few months back, and ever since then, just been watching along on their journey as they navigating early stage startup life. And so, before we jump into what Akin Mental Health is, we'd love to just kind of start with who you are, Stephanie. So, just the broad overview, whatever you want to share about, who you are as a person that got you to this point in the journey.
Yeah, thanks so much. I'm really excited to be on the show, Adam, and share a little bit about our journey. So, in terms of my background, I have kind of three sections that I like to talk about that are all relevant to Akin and how we got here. So, one section is a kind of academic life that I'm it feels further and further in my past, but I have a PhD in neuroscience from UC Berkeley, and I was studying the brain and how the brain makes decisions and our emotions. And then I transitioned into working in digital health technologies. I worked at startups. I was also at Apple and Health Special Projects Group, and really got a sense for how digital products are made and got the interest in entrepreneurship and how we can all make our lives easier with technology. And then a third part of my background is very personal to me, but very relevant to why me and my co-founder created Akin, and that is that my mom has bipolar 1 disorder. So when I was a kid, she had a lot of ups and downs with that in the hospital, and it created a lot of chaos in my family. She's also doing really well. She has had successful treatment and is retired from a long career. So I've seen her do well and recover. And the more and more we become aware of mental health, we often don't hear these stories of pretty extreme struggle with things like psychosis or suicide attempts that I've seen in my own family. And so that's another really important part of my background that I bring to motivation behind Akin.
Is the stuff that you dealt with in your family life a bit of a driving factor as to what you wanted to study in school?
Yeah, absolutely. I would say I was very drawn to neuroscience because I was seeing my mom change in a lot of ways when I was a kid, especially she was on several different medications. Some of them helped her, some of them made her just really out of it and withdrawn. Some of them made her angry. And I saw that connection between our biology and the way we behave. And that was actually my initial interest in neuroscience and studying how the brain works. It took me many years, decades really, to get to the point where I was willing to study it that more closely to bipolar disorder or a mental health condition. So my research was actually much more general. I was mostly working with healthy college students and understanding general brain function. But the interest was definitely related for me.
Tell me more about what Akin is and how it got started.
Yeah, absolutely. So Akin is a platform where we deliver virtual online programs to families who care for loved ones with mental illness. So typically that's parents, sometimes siblings, spouses of someone who's struggling with something pretty complicated. So often schizophrenia, bipolar disorder, severe depression, these kinds of journeys is what families are navigating. And our program is designed to give them education and give them the tools to help and the tools to heal for the family.
Got it. Is there a community aspect to it, or when people jump on, is it pretty much just more resources that they can get access to, or are there like forums and ways for people to communicate with other people in similar
Yeah,
positions?
it's very community based, and we try to foster those relationships between the people that join and the family guides with the kin. Those are the people leading the workshops and the members themselves. So we do the core of the program is live sessions that happen on Zoom, but we bring together groups of families, and there's really intimate stories shared there so that they can connect live and hear about what each other are going through. We also have online forum where people can post questions and connect with each other, give support on the website itself as well. And then this is kind of in an ecosystem of lessons that they can review either on video or as part of those live sessions.
How long have you been working on Akin?
Yeah, we started officially in the spring of 2021, and then we started running the live sessions and really the real program of Akin in early 2022.
Okay. And how have things gone so far in the I guess it's still in the infancy of the company's existence, right? The first couple of years I
Yeah.
think are all what learning phase of a company. So how have things gone so far?
Yeah, well, we're really excited to be learning a ton, learning a ton about families really most critically and their needs. So one um, like phase of thinking was about is this really a care navigation problem, just connecting to the right resources? And what we found talking to families is they have so many more goals on top of that, particularly communication and understanding what's happening, and they're really locked out of the medical system. So we've learned a lot, and we find that there are so many families that are looking for this type of support. So we've had over 8,000 people sign up on our website to learn about Akin. We give them a short report about their information. And then we've had several hundred people joining our PRAID program and participating in our workshops. And I think one of the things that's interesting is to see these patterns, even as somebody that's experiencing this in my own family, or my co-founder who also comes from this from personal experience. You feel like you're the only one that's had
Mhm.
this issue or a particular flavor of this issue. And then I think one of the big learnings is connecting with so many families that you see kind of the same patterns, and you're really not alone. There's a lot of people experiencing similar things.
So
Um,
obviously this is a business. So how do you get paid as a company? Does the government reimburse you? Are you getting paid direct by the families that are using the platform? How does that all work?
Yeah, we're paid directly by the family. So our program for the live version is $74 a month for families to join, and they typically join weekly workshops. And then it's about $40 a month for self-guided video version of the program. And we work direct to consumer. We plan over time that the company would be a service that's reimbursable by
Hmm.
insurance. However, we are really focused now on scaling direct to consumer and reaching families directly. We find that in mental health in particular, you'll see these trends where if there's something new, it's often really driven by the consumers to lead the
Hmm.
charge to make it happen and make it grow. I mean, even if you look back at something like Headspace, um, where it was new to think about meditation in your wellness or as part of healthcare. And they grew that direct consumer. There's so much demand. Now they're
Sure.
getting reimbursed by all kinds of all kinds of insurance plans, and
Hmm.
they're building out their clinical offerings to build into that. So
Sure.
we see this as it's somewhat new for people to be thinking about family support because we're not seeing patients directly, and we're not providing direct treatment.
Yeah.
So we see the demand on the families, and that's how we get paid and
That
work.
that is unique, right? I think uh, as an investor, you see a lot of companies trying to come after this from the patient side, but you
Mm-hmm.
often don't see a lot of support for the caregiver side. Have you
Mm-hmm.
seen or do you have evidence of, and maybe it's still too early, better outcomes for the person, going through the issues that they're having, or at least for the families? Like, what kind of KPIs are you keeping track of that you might be willing to share, like performance indicators that might be interesting for the people listening to hear?
Yeah, absolutely. Well, first in thing that you were mentioning was the outcomes tracked to the patients. And We are a little early to have those on our specific program, but we're based in really decades of research that not
Hmm.
only show that family support is effective, but it's actually one of the most effective tools. There was a meta analysis that compared everything that you could join with prescribing medication, and family approaches was the had the biggest impact on the patient, and it showed averages of 50% reductions in hospital readmissions
Mm.
for patients with schizophrenia. So what happens is
That's a
when the,
really that's significant. Yeah.
it's huge. And what happens is when you have someone who is having issues that their family isn't understanding. They don't know how to
Yeah.
help or where to connect. And the way that, at least as particularly the US system is designed, is that even, a 24-year-old who might have still a lot of connections with their family support system, with their parents, if their parents aren't actually given any information about
Hmm.
what to do in a crisis, they're ending up in the ER a lot. And the other thing is, these are part of the symptoms is, living in a different reality from people, and that escalates into conflict and arguments in families. And so both of those things, where families can understand their own responses, and understand where to connect, make a really huge difference in terms of outcomes and support. And
Yeah.
then we're also very focused on the outcomes for the family themselves. So
Sure.
I mentioned those, thousands of families that have signed up for our site. We ask them, on a scale of 1 to 5, how stressed are you? And over 70% are 5 out of 5 in terms of how stressful this is for them. And that's where we see a dramatic difference in our program.
Right.
Will become less stressed, or even if they are still, because this is still, a health challenge that everyone's dealing with, they're still um,
Sure.
somewhat stressed, but also gain a lot more confidence in their ability to manage both their own feelings and kind of the situation broadly. And so those are some of the indicators that we pay a lot of attention to, and that we are starting to see change in the
Yeah.
families in our
I can
program.
only imagine how hard it is for multiple reasons, right? When I personally went through some family health related issues, I remember going on the journey of trying to find information to best support. And it's the Wild West out there. The internet's a blessing and a curse. You can type
Mm-hmm.
in something to search and go down 25 different rabbit holes of information, and you don't know what's good and what isn't. And so, as you're navigating trying to be a caregiver for somebody else, and especially if you don't come from having the right background of knowledge and understanding of the nomenclature or the words that are being used, it can be very, very challenging. So having a resource that helps you navigate that in a way that you can understand as just a I don't mean this in a bad way, as just an average person,
Mm-hmm.
is super important. So I think that makes a lot of sense. And probably too early by a long shot, but my guess is that if you compared the cost of healthcare for families, the individuals within a family that have to care for somebody in this space, I bet even for them they have additional costs on their own personal healthcare
Mm-hmm.
savings, or potentially by providing a better resource system and community system for them. Um,
Yeah, absolutely. And there's
yeah,
been some really good research from that on the National Alliance of Mental Illness, and shows that caregivers for mental illness have actually somewhat higher health burden than other types of caregivers. And a lot of that's related to the isolation and the
sure.
stigma that they face. So they
And they
have,
don't want to talk about it with their friends and family,
yeah.
that because they don't want to be a burden or perceived to be a burden. And there is all that, like, oh, we shouldn't talk about this in public. That's just kind of somehow become the 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 most, like, universally accepted thing in society, is we don't talk about our own personal issues, or
Hmm.
our family's issues. So you just bury
Hmm.
down deep, and then yeah, you do feel very isolated and on an island. Um,
Hmm.
just so I don't forget, if families are hearing about this, or people hear about this and want to pass on information to others, what's the best way for them to find your services? Is there a website that they can go to easily, or reach out to you
Yeah.
directly?
Yeah, absolutely. Our website is akinmh.com. So akinmh.com. That's the easiest way to come and sign up. You can also email our team at hello@akinmh.com, or me directly. I'm just my first name and our website address there.
Awesome. What kinds of cool things do you have coming up on the horizon that you'd like to share with people?
Yeah, we are just excited for our program to grow. We're thinking a lot about how to um, meet families where they're at on different types of journeys. So, right now, our program has been some of the most successful with families navigating things like schizophrenia, schizoaffective disorder, and we're investing more and thinking more about how to make things for families that are navigating bipolar disorder more specifically, and depression and severe depression. Those have some unique challenges. So we're excited about developing out our program more. And we're beginning to try to get some interest for one-on-one coaching as well
Mm,
at Akin. So that's another thing that we are starting to build a wait list around. If anybody wants to reach out and get more information about that. We see a lot of value in the group and the community, and now we're growing at a place where we think we could support some individuals that want more personalized guidance while getting information in the community format.
yeah, I mean, building a startup it takes a village. What kinds
Mhm.
of folks that are listening would you be interested in connecting with? Would it be investors, potential people that want to work for you? Like, what kinds of groups of people are you looking to connect with more broadly, just to kind of help move the mission forward?
Yeah, yeah, absolutely. We are looking to connect with investors. We're currently working on fundraising now and would love to connect to investors. We have our initial backing from Precursor Ventures and from Berkeley Skydeck, and we are at a place where we've built out some initial program and looking to connect to investors to grow and get bigger. We also really enjoy connecting with other mental health professionals or groups who are working with patients. We hear all the time from these groups that they are looking for resources for the family. They understand it's important, but of course they don't have the time or sometimes the expertise to help families on their journey. And so we love connecting to those folks and partnering for referrals to our program, and so we can help support more families.
Got it, got it. And then I wouldn't be doing my job if I didn't ask this question. What makes you different from the status quo today, or your biggest competitor, right? And you don't have to call anyone out directly, but I guess, why did you decide that there was an opportunity for you to jump into this and invest your time and your energy into it?
Yeah, I think it's really this lack of support for families that are navigating this. So, if a family has a loved one who has a diagnosis with schizophrenia, for example, they might try to reach out to, a clinician, but they won't usually talk to you about someone else's mental health condition. A crisis line is waiting for you to be in crisis. Friends don't understand. And support groups is where there's more prevalence. It's still somewhat hard to find, but there are some great organizations, and the National Alliance of Mental Illness does really great support groups throughout the country. But those often aren't giving you kind of guidance and education. There are a couple exceptions from that, and actually some from that National Alliance of Mental Illness that are good. But really, having this available and accessible to all families is
Yeah,
so far from where we are that there's a huge opportunity
sure.
to give people that guidance, and that's really what makes us unique. Another thing that I find really interesting and unique about Akin is that we find that families often join with multiple people. So sometimes that's a husband and a wife that are supporting an adult child. Sometimes it's a mother and a son that are supporting, a sibling and a child. And that's a really unique way that people aren't often kind of engaged in these
Sure.
other things in all those other categories that I mentioned.
Yeah, I mean, it's a very complex issue at large, and not one situation mirrors another. So, yeah,
Hmm.
it's a very, and I think that's why it needs to be a combination of like scalable educational content, but also community driven, human to
Hmm.
human interaction. So, I think that's the right approach that you're taking, that parallel path. As we kind of wrap up here, any parting words, thoughts, shout outs that you want to throw out there?
Yeah. Well, I didn't get to talk too much about my co-founder, Matthew Montanez. He's been a huge part of this journey, and he comes from personal experience and also amazing professional background of building technologies. So I feel really fortunate to be building this company with him. And we really try to spread our message of Akin. We have 4 principles that we tell families, which is mental illness impacts the whole family. So we really shouldn't think about it as an individual problem with an individual solution, but really impacting a whole group. Your response matters as a family. You matter. So your health and your well-being matters. And recovery happens in collaboration. And at Akin, we really hope to promote collaboration within families and to be part of that collaborative system for families and patients.
I love it. Well, Stephanie, I think you're doing some really challenging and important work, and I know you've got a lot of good impacts that are going to be, because of the work that you're doing. So, kudos to you and your partner at Akin for taking on this ultra challenging mission of yours. And if people are looking to reach out to you, again, go to their website, akinmh.com, akinmh.com. I'll put it in the description so people can find it as well. And then finally, if you want to reach out directly, I think her email is just Stephanie at akinmh.com. So, if you have questions, feel free to reach out. I'm sure she'd be happy to help you. Thank you again so much for joining, and really appreciate everything you're doing for the families out there that need it.
Yeah, thank you so much. I'm really happy to have the opportunity to talk and really appreciate your thoughtful questions. So thank you so much.
All right, that's where we'll end it.